I'm so lucky. I'm looking to make a difference with Gail because I get the best of the best. And I want to share that with you. Let me ask you some questions. Do you know what body contouring is? Have you ever considered Ultherapy, Cabela, or Fraxel Dual? Do these treatments really even work? In my new segment called Skinformation, I have the award-winning dermatologist Dr. Kally Papantoniou with me. We're going to discuss those topics and everything you ever wanted to know about laser aesthetics, cosmetic dermatology, and natural alternative methods to treatment and disease. With a background in sculpting and in art, she shares the science and art and has been featured in Cosmo. She's been featured in Self Magazine, Glamour, Vogue, Parade, Lifestyle, and most recently in New Beauty. And I love that with a little profile and a fabulous picture of you in there. Welcome, Dr. Papantoniou.
Thank you, Gail.
Oh, so happy to have you here. And I love it that when you were asked to describe yourself in 3 words, you picked the 3 words that are just so powerful and so helpful. They are warm, which you definitely are, creative, and dedicated. And I have to say that when you go to Dr. Papantoniou's office, Simply Dermatology in Melville, you'll find the staff is very warm and caring as well. That's so important. I tend to judge a doctor by the people he surrounds himself with. So I love it. It's beautiful, it's clean, it smells an amazing, great smell. We're all trying to find that odor where it came from. But I'll tell you what, it made me very comfortable when I went in to have receptionists. Hi, how are you? So we're welcoming you, but I also want to mention before we go on that you are board certified, the American Dermatology. You are with the, I guess it's the Fellow of American Dermatology.
Right. Yes.
You were voted Super Doctor by the New York Times, and you are also an associate professor. I mean, with all of these incredible titles and your background, why is it so important for people to know, where you're licensed and all that background?
It's important to know what any practitioner's background is before you entrust them with your life, with your skin, with anything really, because there are certain procedures which have potential complications. There's an art to the way things are done. There's a different skill set that not necessarily everybody will be able to provide. So on top of looking into what somebody's certifications are, you also want to do your homework. You want to ask around, maybe do some research into how they work and how happy their patients are when you're doing something.
Absolutely.
Because unfortunately, with anything, this is the case, that you can have the education for it, doesn't necessarily mean that you're going to have the skill set in order,
or the
vision,
bedside manner,
or the bedside manner, in order to perform best and to be able to deliver the best results and do the best job. That, and also there are certain people who practice these days that don't have any licensure, and
Absolutely.
they're doing procedures, they're using lasers. In my practice, I deal with a lot of patients that come to me as a second opinion for help after they've had complications from injections, from laser treatments, or from misdiagnoses. So I do think it's really important that you know who you're seeing, and just to be careful with yourself.
Now you
and even
went to NYU, and then you went to...
I went to State University of New York, downstate.
Okay. Downstate.
For my medical.
And then you did your residency at Long Island
Jewish for my internal medicine.
Okay.
Then I went back into Brooklyn and I did the rest of my dermatology training.
And I love the fact that you encourage people to do their research, to find out who you are, and talk to different patients. I am one such patient. All right, so why dermatology? When did you get interested in this field?
Well, I just always knew I wanted to be a doctor. I didn't know for sure dermatology was, the way I was going to go.
Right.
Always had a fascination with skin. Definitely suffered with acne as a kid.
Really? Do you think that's what got you into the field? Your skin is beautiful.
Thank you.
Yeah.
That and family history of eczema definitely was just such a struggle. And then learning about it in medical school was just such an eye-opening experience, and it was just it didn't feel like work, and it was just so
Something
enjoyable.
That gave you pleasure.
Yeah, completely.
And you loved it.
Such a
I
pleasure.
love that. It's fascinating. And I had asked you, I said, as a former teacher of English, I do listen to the way people speak. It's been years since I've retired. Totally different field. But I asked you the same question. Do you look at people's skin right off when you see them?
Yeah. Well,
Can't
I
help
try not to, it's hard not to notice,
But you have to. You have
it's
to
hard
look
not
at
to,
it.
yeah. Well, I don't give advice unless it's asked.
No,
that I won't do.
absolutely.
If I see an irregular
I
mole,
would never correct
if I see an
somebody.
irregular mole, I might say something to
Really?
somebody
Okay.
that you should
All
get
right.
it checked out.
I was always interested in that.
That for sure is important.
Now, your goals are to refresh, restore, and rejuvenate. What is body contouring? And at a later date, we've invited Dr. Papantoniou back because I know there are going to be a lot of questions, a lot of interest in all of these fields, and we're just so privileged that you'll be able to share this with us. Right. But for right now, very quickly, what is body contouring, and what does that mean?
So body contouring is the reshaping of distribution of fat on the body, okay? I'm interested in non-invasive body contouring.
Right.
So I use different devices to help with stubborn fat pockets that with exercise, diet, with all the hard work possible with your goal weight that you cannot achieve, that's where body contouring comes into play. So it's a way of reshaping. In a non-invasive way. No needles, nothing.
I like that, non-invasive. So I can take a little bit from here and I can push it up. All right, Kybella, am I pronouncing that correctly?
Yes.
What is that?
Kybella is it's actually an injection. The name for it is deoxycholic acid, and we use it to dissolve fat. You can inject it. The area that's FDA approved is right here in the submental area.
Okay.
So for somebody who has a full area here or the jowls,
they want to
you can
eliminate.
Very simple with
How
injections.
is that different than from old therapy, which is also similar?
Therapy, totally kind of different.
Okay.
In a way that Kybella will dissolve fat and help that contour. The Ulthera works with ultrasound. So the ultrasound helps to trigger and stimulate your skin to produce collagen. So you'll get picking
and
up and lifting.
And collagen is, for those not conversant with it, collagen is
a fiber that's produced in the deeper layers of your skin that make your skin nice and firm. Okay. So,
and the other one was Fraxel duality.
Yes. So the Fraxel, it's a laser that works very different from how the Ulthera works. Fraxel creates little micro perforations in the skin that you can't even see with your eye.
Oh, okay.
But you're only a little pink after, like a sunburn. So most people can do a treatment on a Friday, and Monday they put makeup on, they go back to work, they go back to school. It's really great for acne scarring, fine lines and wrinkles.
Oh, this is wonderful.
Discoloration.
And we know if you look better, you feel better. You feel more comfortable.
It's true.
The layered look, that's what you are known for, so explain that.
Okay. So I like to promote this idea of rejuvenating with a layered approach. What does this mean? This means that we don't try to use just one thing in order to improve the way someone's looking. That means I'm not going to suggest tons of Botox and tons of fillers in order to change someone's face. There's just so much you want to do of these things where somebody can lose their shape. They can lose the natural contours of their face. So you want to incorporate different treatments. You want to
make it natural.
You want to really look natural.
Right. Okay.
So you want to maybe do
important.
a little tightening. Then maybe you want to do a little bit of filler. Then maybe you want to address brown spots or the lines. So you might want to do a laser treatment like the Fraxel.
Okay.
So it's really different kind of angled approach in order to get a more overall natural look.
Oh, I like
where
that.
You're maintaining yourself.
We have seen people and we've said, what happened to them? Because their faces are either frozen or it's just too much.
Yes.
And it's so sad. All right, now this new segment, Skinformation. I love this because I know you're going to have so many questions about this field, and some of the questions, I'll just give you some ideas of where we could go. I mean, we can ask about acne. You could ask about, are we doing too much, I guess I want to say too much Botox? Are we starting at too early an age? Or how do you know when enough is enough? When do you know?
Right.
I'm in a field where I've seen young girls doing it, and wanting to do it in their teens, and I've been shocked. Okay, so we want to know those kinds of things. How safe is lip plumping? If you've had enough Botox and you've had, enough laser and it's no longer working, do you have to go to plastic surgery? And I have a question that I'm going to have to ask in the next show and have it answered. I grind my teeth. Someone told me Botox in here. Does that change the shape of your face? And who do you go to for that? Those are the kind of questions we're going to ask. There's so many things, but those are really, really important. So we're going to put this up for you, but it is gailking.skinformation@gmail.com. But we'll have that up there. Any questions? And I know that you get so many. And these are things that people just want to know. All right, today's topic is skincare. Sleep is so important. To me, I think it's the most wonderful beauty ingredient we can have. Right? Would you agree?
I completely agree. I love my sleep.
I think it's interesting to note that what happens during the first few hours, the second and the third. Like in the first part, your pituitary is affected. The second part would be, melatonin. And the third would be cortisol. So can you explain that a little bit?
So what I think is the most important part of our sleep patterns is really the deep stages. So stage 3 and stage 4 of your sleep. That's when your body's releasing growth hormone. So that's what helps your cells to turn over.
That's pituitary. Yes or no?
Pituitary can release it. There are other parts of the body that also release growth hormone.
Okay.
But it's going to stimulate cell renewal, new collagen to be produced, and it's really the peak of regeneration. So you don't want to deprive yourself of that deep sleep. That's why it's so important. They've done actually studies where if you don't get enough sleep or you have a lot of stress, that your skin can actually have issues. You can have rashes, ulcers. Can even occur if you have severe sleep deprivation.
Wow, so that's so important. So now let's get a few maybe tips to get true beauty sleep, like melatonin. What do you think of that? What are some of the tips for beauty sleep?
So I do think having a routine is important.
Okay, routine.
Having a routine, and in the sense that at night, every night, kind of having a pattern with yourself, almost the way you would put a child to sleep, right?
Okay.
You have the pattern. You read them the book. You give them a bath. You put them in their pajamas. Especially for somebody who's having trouble getting to sleep. So having a pattern, I think, definitely helps. Keeping consistent with your hours, not trying to get to bed too late where you're exhausted and then going to sleep.
What about a blue light in the room?
Yeah. Something like that could be helpful. Blackout curtains, if there's any ambient light coming from street lamps outside. A noise machine would be good. Taking a warm bath or a shower before going to bed.
Not hot.
Not hot, but warm.
So you taught me that. I sleep on my back, which I think is probably somewhat helpful.
It's the best for aging.
I taught myself.
That I can say. You side sleeping on your face. These are the ways that we don't want to sleep. If you can sleep on your back, that's going to be the best. I can tell when I'm assessing a patient what side of the face that they sleep on.
She's
favor.
She's looking at.
If they favor one side, the side that they sleep on, the eyebrow will be a little bit lower.
Really?
The eyelid above will hang down a little bit more. The cheek will be a little flatter. So you can tell.
I never knew all of that.
If you study somebody, you can tell if they're a side sleeper.
What about pillowcases?
Pillowcases, generally, the silk pillowcases will be better. It's a natural fiber, so it will carry fewer bacteria. It's going to be more of a breathable material. Less drying for your skin, nice and smooth. So definitely the silk pillowcases are
nice. And melatonin, you had mentioned, my dog is having so much trouble sleeping right now. She's getting on in years. I've had no sleep for a week, and I was to give her melatonin. Well, the two of us hit the melatonin last night. I knew I had to get sleep. But what do you think of the melatonin?
I think if you're having trouble falling asleep, then I think of all the supplements or the next step of taking something to help you, I think would be a good choice. I don't think it's an unhealthy choice.
Okay. All right.
But I would only recommend it if you really had a hard time getting to sleep.
Right. Her veterinarian prescribed this for. I would never just give, an animal melatonin. It had to be a certain type, a certain amount for her weight, and I was up and she was snoring. Okay, so some of the skin sins. Here's this whole thing. Now, I know you have to wash your face every night, no matter what. If you're out partying, if you're out till 2 or 3 in the morning, and you come in, you should still take all of that makeup off, right?
Correct.
But do you have to wash your face in the morning then if you've already done it?
Well, that really depends on the person. Sometimes, in all honesty, in my office, depending, if I have somebody who has skin issues, very sensitive skin, very dry skin, they suffer from eczema, I'm not going to recommend that they wash again with the soap in the morning.
Okay.
A little bit of water would be a good thing. A little bit of water just to remove any sweat that had accumulated while we're sleeping, just to refresh. And then also, you're probably going to moisturize in the morning, right? And you're going to put new products on. So you really want to start with a clean face before you do that. Otherwise, they actually won't penetrate well. So you actually want to have a clean surface before you do that. So.
And I know that you said not a hot bath because it dries out your skin. And the other thing too, and it was interesting, you should stay away from a fireplace by a certain number of feet. What was the foot? 3 feet?
I think it's at least 3 feet that you want to keep back.
Again, for the same reason?
Well, the heat can cause damage to the collagen and elastin fibers. So if you have repeated exposures or you always take very hot showers, you know, it takes a toll on your skin. And as we get older, things just don't repair as well. So you're just making it even more difficult.
I thought this was interesting. And we're just finishing actually now. Of course, we're in summer, but spring cleaning. I love that. Just as you are spring cleaning your home, you want to do the same thing. So I looked around the house to see what I had that would be considered natural and good. And of course, we have water. I have coconut oil, and I was using it on my dog for her skin. And then I found 100 uses for coconut oil that everybody's talking about. Apple cider vinegar within and on the outside. Baby oil, and Epsom salts. So I'm going to ask you about cleaning a few things. Your scalp. How do you do that with some of those items?
So if you want to use a natural product to really do a deep cleaning for your scalp and get your oils in balance and the yeast that all lives on our scalp, that's what dandruff is caused by the way, which a lot of people don't know. It's actually from yeast overgrowth.
It's yeast.
It is.
Okay, I didn't know that.
So if you take some apple cider vinegar and dilute it, you can do a 1 to 3 dilution where you have 3 parts water, 1 part of the apple cider vinegar. You can put it into a bottle and kind of drip it onto your scalp, massage it in, let it sit for about 10 minutes, and then go in the shower and rinse it out. That will help to gently exfoliate dead layers of skin off your scalp. It'll help to remove buildup and debris on your hair from hair products and shampoos. It's a really nice way to refresh, and it also helps to reduce the pH on your scalp, which helps to minimize the occurrence of yeast there as well. So for somebody suffering from bad dandruff,
look at that. You just solved somebody's dandruff
an apple
problem.
cider vinegar treatment. And then if you don't like the way it smells, you can actually just shampoo after. So you want to do your treatment first, and then you can use regular shampoo.
It's interesting. It's almost like we're going back to all the treatments that our grandparents had used. What about drinking the apple cider vinegar?
Well, drinking apple cider vinegar has so many health benefits, especially
it tastes so awful,
it does
Doctor.
taste bad. You can mix it with a little raw honey together. That does help, and it doesn't have to be a high quantity of it. I think things in moderation are the best.
The best.
For a couple of reasons. One, you're more likely to do it. Okay. Second, it's more cumulative. So it's better that you have a little bit of it every day rather than not have it at all.
Add like stevia or something.
Yeah, you can add anything,
like
agave, something nice like that. But there are a lot of active enzymes in it that help your body. It's more than just the acidity.
Now, we're getting our feet done. I cannot begin to tell you how many infections getting a pedicure. And I'm sure that you must have seen this. So what if we want to do our own pedicure? How do we do that? What do we use? I know Epsom salts.
Definitely you can soak your feet in Epsom salt. You want to soak them for about probably 10 to 15 minutes in warm water with the Epsom. That will help to soften dead skin. Then you can exfoliate with a loofah stone.
Or
like a pumice stone. Or
you can buy that.
Yeah, they sell kits for at-home pedicures that you can use for yourself. They have depending on how thick the sole is on your foot. But really, it's really limited by how flexible you are. Unfortunately, we reach an age where it's hard to take care of your own feet. So a lot of people, even though they may not want to have to go somewhere, they really feel like they don't have a choice, that they have to go.
Right.
So if you have to go and you are concerned about foot infections,
Right.
it's best to go to a place
And get your own.
where they bring your own supplies with you,
Absolutely.
or you can go to a place that autoclaves them. That's where they put the tools into a heated autoclave and they get sterilized.
That's very important.
And then if you're going to be soaking your feet at the pedicure salon, you want to make sure that they have the basin liner, which is a little plastic liner. So this way that water isn't communicating with the water that touched somebody else's
Because I'm
feet.
sure you've seen a lot of infections.
I have managed many infections that were acquired.
Sad, right?
I had a patient that ended up with an amputated toe because of an infection she acquired from having a pedicure.
Okay.
So, and it was tracked back to the place.
I've
So
heard this.
you want to
I've
be
heard this.
careful. It's
You
not
wanna be
everyone's going to have
careful.
a problem, but especially for
Right.
the elderly. She was elderly, and you're a higher risk because the immunity isn't so good. So something like that can
All right, let's talk
happen.
about some foods that are good for our skin. Green tea. I know it's vitamin K, and I know I've actually taken the tea bags to prevent some swelling, not sleeping, and cooling it and putting it underneath the eyes, and it does help. And it's an anti-inflammatory. So tell me a little bit about the green tea.
Right. Well, green tea just has so many benefits,
Yeah,
both
let's-
internally and externally, as a
Okay.
topical agent and drinking it. It's loaded with polyphenols. Polyphenols are super antioxidants. They help your skin to repair damage. We're getting damage from every angle.
Everything.
You're getting damage from the sun. You're getting damage from free radicals. It really helps give your cells all the help they can take for repairing and dealing with the damage that we have on a daily basis. And they've done some studies where if you drink green tea, like 2 or 3 cups a day, it reduces your skin can tolerate more sun before it will get a burn.
I'm going to do that. Once in a while I'll have it, but I think I'm actually going to do that. Walnuts with the collagen, right? Walnuts are good for collagen.
Well, they have they're rich in omega fatty acids.
I've been
And
eating every day
the
now.
omega fatty acids they're great for your skin and your hair. The same way that some people give omegas and they'll give healthy oils to their dogs for their coats. You hear, they're like, oh, and the dog's fur coat got so nice.
Right.
Well, it's the same thing with people. If you
Wow.
eat these healthy fats, they're really good for you. A lot of people don't want to eat a nut like that, like a fatty nut, like a walnut. They're like, oh, there's lots of calories.
Oh, okay.
But you don't, I don't consider those things calorie
No,
laden.
that's for your health.
They're
It's
so
more for your
healthy.
health.
They're
And it fills
so
you
healthy.
up. I find when
Yes.
I'm eating that.
Yes.
How about watermelon? Again, for
Well,
puffiness?
watermelon's very hydrating. Very hydrating. A little sweet, but definitely hydrating, which would be good for somebody who's looking to
Now,
hydrate.
what about
that doesn't drink
cacao?
water.
That's the chocolate.
Right.
Has to be at least 70% in order for it to be, or not?
If you're looking for the health benefit,
Yeah.
you do want higher. The higher, the better. And again, potent antioxidant, been proven to be very helpful. Has, however, been linked to acne, and this has been proven in studies.
Really?
It has, yeah. So it's not just that the sugar is there; it's just chocolate.
Chocolate.
It can for some
I
people.
didn't know that. I thought that was not.
I know. I thought it was a myth
I
too.
thought it was a myth.
Yeah.
Grew up thinking that way. All right. Water infusion. How much water should one 96 pounds? How much water should one drink? And I know that I now am putting oranges in it because I hate the taste of bland water. So how much water should somebody drink a
So
day?
generally, they recommend 8 glasses a day.
Just 8
glasses
It has
a day.
nothing to do with your body weight? That's
If
why I gave you my weight on TV.
if I would stick with the general. The only time I'm really recommending strictly for me is if I'm doing body contouring for a patient and I really want
And
them to
then
up their water. Then I'll have them drink their weight in water.
All right, the last topic for us today, and don't forget that you can write in. We'll show the address again for your questions. But the last one would be your skincare creams. I'm seeing BB, CC, DD. I want it all. And then I realized they're not for everybody. So what is that?
Right. Well, they originally started in Korea, in Asia. The whole idea of
Beautiful skin.
yes, well, skin is so important there. Many trends have started there, and then we've adopted them here. So it's really interesting how that happened. And actually, it was first developed by, she was a doctor in Germany, if I'm not mistaken, and then picked up in Korea, and then back here.
And then back here.
So it's the idea of using makeup, but also treating your skin at the same time. So it's more than just makeup on its own. It's more than just sunscreen on its own. It's a way of introducing a routine through one simple step, which is really neat. So the BB creams, generally speaking, it's like a tinted makeup that's not very heavy. It's not full coverage. It's more sheer.
Like a balm.
Like a balm.
Okay,
And
got
then
it.
most of them are SPF 20, SPF 30. Some are even SPF 50. So you get your sunscreen together with your
Good,
cream.
because I know I react to a lot of the skin creams that are for the sun. And I'm trying to get things that are 20 or 30, wear sunglasses and cover my head.
Right.
But
it makes it easier when it's together.
Easier.
Exactly. And then the CC creams they're corrective. So there might be a brightening agent together with the tint, with the sunscreen. Then there might be vitamin C. There might be kojic acid.
So could you take all of them, or you should know
you
what's
could apply
for you?
them. Well, it depends on what you're looking to
for?
achieve.
Okay.
If you are just looking for skincare and sunscreen, then you just would use a BB. If you have correction, then a CC, and then the DD is really like all three.
I'm a DD. Well, I have to tell you, this is fascinating. There's so much, just a plethora of information that you're giving. And I want to thank you so much. I learned things, the green tea. I learned about the BBs, the CCs, the DDs. And I think that I'm going to apply. You know, it's not easy to apply everything at one time. But if you glean a little bit of information and take from here and take from there, it does impact your life. Just having that much water every day has helped improve. Thank you, Dr. Papantoniou. A pleasure, and we're going to see you again.
Thank you. Thank you for having me.
Thank you. Baldwin said, "The secret of staying young is to live honestly, eat slowly, and lie about your age." Now, that's nonsense. And you know why? Because we have, and we're so fortunate, Dr. Papantoniou back in the house with Skinformation. Hi, Doctor.
Hi, Gail. So glad to be back with you.
Oh, I know, it's exciting. You know, you have such an art because you're able to make people, when they come in, not only feel comfortable, but you also assess their faces. And for you, beauty is about balance. And many people may not know that you sculpture, and a lot of the artwork in your office is made by you.
That's right.
So you have this whole idea about beauty. Today, though, I want to talk about, I'm looking to make a difference with Gail. I want to talk about the questions that have arisen. Getting a lot of feedback, and I thought today would be a great idea to clarify. So the first thing I want to talk about is this layering approach. How does one achieve natural beauty with layering? When you hear layering, you think layer, layer, and layer. So how does that happen?
Well, it's really about approaching the skin from different angles. It's not really, you don't want to just use one modality in order to improve our skin or our contours, right? This can happen when you don't have enough tools or you're not thinking broadly. If you're using just filler in order to improve someone's contours, it can look overfilled. If you're using just lasers, then perhaps they might need some volume. So it's about approaching from different angles, improving the quality of someone's skin. I like to think of it as the canvas, almost like the canvas that you're going to be working with, right?
I like
so you want to
that.
have a nice, even canvas to work with. You want to replace volume. We all have volume loss. And then you want to do something for tightening. Perhaps there are fine lines or wrinkles. Perhaps there are dark spots. Perhaps there's acne scarring from when you were a teenager or even as an adult still getting acne. There's ways of improving the quality of your skin, the contours, and the tightening. So that's what I like to think of as the layering effect.
So you're looking at the whole
It's
picture.
the whole picture, not just one angle, multiple angles, in order to get a natural look that's overall, where you can't even tell that anything's been done. That's what most of us want.
That's the best. How many reality shows have we seen where you say, oh my goodness, the eyes are up here?
Right.
But if you're doing it more natural, that's really what we're looking for.
Right. When it's done properly, you can't even tell who's doing these things. And so many of us are doing something these days to keep up.
Now, spas have been scrutinized most recently, and we're hearing so many different things. We're hearing about people getting infections. Sometimes it has to do even with, I hate to say this, but amputation. So let's talk a little bit about that, what people should be looking for when they go into a spa. You want to go in and you want to be pampered and feel fantastic. You don't want to come out and say, I can't believe this has happened to me.
Right. So definitely you don't want to pick your nail salon or your pedicurist based on price. You're looking at a clean facility that's kept up to date. For the soaking your feet, you want to make sure that they have the liner on that. You want to make sure.
Sorry, so it's not just enough for them to clean it out.
Correct.
They have to have a liner.
I would definitely recommend a liner. You don't want to reuse any of the water. You don't want any cross contamination happening.
And that can happen.
That can happen. And then the instruments that they use to clean the nails, to trim the nails, either bring your own equipment with you, or make sure that it's the facility has an autoclave. An autoclave is...
Just going to ask you, what is autoclaving?
It's a machine that, through high pressure and temperature, will kill any fungi or bacteria or viruses that can live on equipment like that. So you want to see that sometimes it looks like they did it, but it's just a resealable bag and they just put it in there. So you want to ask them, did you autoclave this? And they have to tell you whether they used an autoclave or not. And it's not an expensive thing to do. It's just you have to have that in order to properly sterilize your equipment. Because we have seen people come in with bad infections in their nails. And I did have a patient that had a small amputation related to an infection that was acquired from a nail salon. So it can happen. They're rare, but you don't want to have those risks. Why should you when you're going in for a simple procedure?
And I think people, doctor, are uncomfortable when they're going in to ask these questions. But isn't it better to know up front?
I think so. I think we should put in the back burner any shyness or timidness that you might have about that. These are very legitimate questions that you have every right to know as a customer, and don't be shy to ask, I would say, for sure.
I know one time I went to a place and it felt good, and I, having the bottom of my feet, they scrape it, but became raw.
Oh, really?
How do you know when to say to somebody, stop? Because it didn't hurt while the person was doing it.
Right. Well, I think you have to, that's why it's good to see the same people also. If you jump around, if you're seeing a new person, new people, you may not know their technique, they may not know you or how soft your feet are or how delicate, but really I think it's just based on judgment and skill. If somebody's well skilled, they're not going to take it to that point, because you shouldn't have had to say, hey, that hurts, don't go like that. They have to pay attention to what they're doing and see what's happening with your skin, because if you're looking at what you're doing and you know how much pressure you're applying, that shouldn't have been an issue, really.
Yeah. And the person wasn't there the next time I went.
Right.
The person was gone. So you're absolutely right about that. Gel nails, you hear so much about it. I have the gel nails right now. And my question is, when do we have to take them off? Should we have to? Is it safe? And I've been doing this for years.
So the longer you have an occlusive type of nail polish or protection over your nail, you can get moisture trapped underneath. So when it's on there for long periods, like a full month, you're creating an environment where fungus can grow potentially, or bacteria or fungus can grow. So generally, like maybe twice a month, like every 2 weeks to have it removed. Give them at least a day or two to breathe, and then reapply. I would say
that's good to know,
especially for the toenails, because the toenails, the polish can stay on so long, and then you forget that you had it on.
Well, I don't do gel on my toes, but this is basically, for my fingernails. You go into the machine. Is that dangerous?
So there are certain concerns. There are concerns about the ultraviolet light, the bulbs that are on these devices, in order to get that gel to set. So there is concern. There is no present data that shows that it's going to increase your risk for skin cancer. However, in the long term, can it? It can. It's a potential risk that, we have to think about. You can try to counter that by applying sunscreen to your hands when you're going into the nail salon.
I've done that.
That's one measure that you can do to help protect your nails. And, it's hard for people to not do this, because nothing else works as great. Because it's so durable, there's no chipping. So
and they look great.
Most importantly, to go in for your skin exams. Go in at least once a year. If you are a high risk, you have lots of sun damage, you have a lot of moles, the doctor has told you come in every 6 months, then go in a little bit more frequently, and pay attention to your hands. The good thing is it's your hands, and you can see them. So if you notice anything that wasn't there before, or it looks out of place, to be concerned about it and not to let it just go.
I find that some people, I don't know if it's out of fear or they just don't have the time, afraid to go and not have it checked, right?
I think you're 100% right with that. That can happen with any medical problem. Sometimes we don't want to know that there is a problem, or we're concerned. But it's so much better to know that there is a problem early on. This way you take care of it, and you don't let it become something that's
You can
more
always say,
challenging
no,
to
I
treat.
won't do it. But at least you have the advice there.
Correct.
And can
100%.
utilize that information.
I think that's very important.
Alcohol and the skin. A little bit of alcohol, and with fun, nice drink, goes with food.
Right.
But when it starts to dehydrate you and robs you of your minerals and your vitamins, right?
Absolutely. Everything in moderation. Everything in moderation. Overuse of any alcohol substance can certainly also aside from being a total health hazard, can increase your rate of damage to your cells and increase the rate at which your skin is aging.
I'm thinking of rosacea.
Yes.
I mean, what about that? I mean, what?
So it doesn't directly cause rosacea, but those who have and suffer from rosacea are certainly going to have a harder time controlling it. They're going to have more progression of their skin disease and can have more flare-ups.
What's the physical manifestation? How does that happen?
So rosacea can have different manifestations, meaning it can look very different from person to person.
Right.
You could either get just simple patches of redness that can fluctuate with emotion. If they are upset, if they're anxious, if they're happy, they might get a little bit more flushed or red. After exercise, they get very red. And it can be red all the time. Then there's another aspect to it where you can get acne-like papules, little bumps that look like pimples around the cheeks, on the nose, even down around the chin. That can happen with rosacea, and there's different ways of treating these different types. But if you cut back on alcohol intake, you will have finer control over it with fewer flare-ups.
W.C. Fields, was that rosacea where his nose became more bulbous and the skin very red?
It's a type of
It was a
rosacea that will
type of
cause
it.
that, called
Okay.
rhinophyma.
I mean, I know that we shed, and this I was surprised to find out, 7 to 9 pounds of skin a year. That to me was just extraordinary. But then when you think skin is our largest organ in the body, it would make sense. Now, some of the things we can do to help ourselves, you told me before to drink 1 glass of water for each alcoholic drink that you have.
I would certainly recommend that because you really want to stay hydrated. Alcohol acts as a diuretic. It makes you urinate more. You're going to dehydrate out without realizing it. So you want to compensate by staying hydrated, which will help your skin recover, and it'll also help you to flush out the toxins as you're dealing with
and the drinks that you have also are significant.
Yes, the type of alcohol, I think, is what you're referring to, right? Can also have an impact. So you want to have, they say the clearer the alcohol, the better for your skin.
Tonic's looking better and better.
Yeah, right. So like wines, beers, the types that are coming from grains, that residue are from grapes. They're rich in tannins, but those tannins can be detrimental. So,
and of course, always washing our face every night.
Right. Oh yeah.
Extra moisturizer, doctor. With
if you're going to be indulging, probably stay hydrated. Definitely cleanse and then hydrate to try to compensate, but also try to do it in moderation. You know, know your limits and know when enough is enough.
A couple more questions there. Now, what about elevating your head on the pillows? How does that help you? What's the purpose?
If you have the habit of sleeping on your back and sleeping on 2 or 3 pillows, that will help to reduce swelling in your face as you're sleeping, and also around the eyes. So that's a really great practice to have as a habit.
Cold tea bags, help me out with that one.
Yeah,
you can ice cold or just
the colder the better,
better.
To be honest with you, the colder the better.
Okay.
You can put them in the freezer for a few minutes and then put them on. And if you use like a chamomile tea, it'll help you. It'll be really soothing and calming. But it can help reduce puffiness. If you wake up in the morning and you have that puffiness.
Nobody wants that puffiness when you awaken.
It will help.
So it will help. I guess the tannic acid in there reconstricting. All right, let's talk. I know at a future date we're going to go into hair loss because that is a huge topic.
It certainly is.
But for right now, you know, the hair loss situation, men and women differences. I mean, with women we have from menopause, pregnancy, birth control pills. But in addition to that, there are similarities. Are they treated differently, men and women, with the hair loss?
There are similarities and then there are differences.
Okay.
You know, for men, they have a few more options than women, and we have our own that can vary between, you know, hormonal treatments. But for men, there are great oral medications which make a big difference for their hair loss. We both use the topical forms of Rogaine, using the right kinds of vitamins, making sure that you're not deficient.
Sleep.
The diet, the sleep, make a big difference.
What if you're vegan? Somebody said if you're vegan, you better add protein because that can also contribute to hair loss.
Yeah, they have to make sure that they have a healthy balance of proteins in their diet.
And today we have men wearing the hair buns, pulling the hair tight up.
That's called traction.
Biotin good?
Biotin is helpful on its own. It's not incredibly helpful, but in context with other vitamins and topical treatments and sometimes prescription treatments, it will work well in conjunction. But on its own,
how do I
not
increase the collagen? Do I take bone broth?
Bone broth is a great way of increasing your intake of collagen. They sell collagen proteins that you can buy at the health food store that come in a powder form that can just be mixed into simple water or into a smoothie. That's a great way of upping your collagen intake.
And acupuncture, will that work?
Acupuncture can help. It can help. May it work as well on its own? Probably not. But
in conjunction with everything?
In combination with everything, you're going to get better results. If you rely on just one thing, you're not going to see as great. And then you have to be really patient with it. It can take a year.
That's the thing, being patient with all this.
A whole year. So I always tell my patients, don't look in the mirror every day. Don't count the number of hairs that are falling. Look at the big picture. Don't stare in the mirror. And then take one good baseline photo, and then we'll revisit that in a year, and we'll see where we are.
I love that. I want to thank you for coming today. One of our future shows, we're going to be talking about fillers. We're going to be visiting you and watching that take place. And we'll be doing a show on acne, from babies getting acne to the elderly having acne.
Very important.
Hair. So anything that you'd be interested in, please let us know so that we can address those issues. Thank you, Dr. Papantoniou. Simply Dermatology. This is Skinformation segment, and you are located in Melville. Thank you so much.
Gail, thank you. Love being on and talking with you.
Thank you.